Now law is a measure that Democrat Governor J.B. Pritzker called the Birth Equity Act. And if you go to thecentersquare.com, you can get the newsletter, wake up each and every morning with the headlines, and go and read about this new birth equity law that the governor signed yesterday. So we'll pull this up and share with you some of the details from yesterday's news conference where the governor laid this out. But as Jim Talamonte from the Center Square reports, Illinois Governor J.B. Pritzker has signed an amended version of House Bill 5142, which mandates the health insurance policies in the state of Illinois, regulated by the state of Illinois, have competitive Medicaid reimbursement rates for doulas, lactation consultants, home visitors, and other community-based providers. Not everybody was on board with this, though. Of course, the governor signing this legislation yesterday, having a signing ceremony where he was surrounded by the bill's sponsors, and they obviously were happy that he put his signature on this. But here's some of what the governor talked about yesterday with the birth equity law and how there's a lot more still to do.
So, as you know, critical access hospitals, safety net hospitals, those I think are the ones that you're referring to, are a real, and those that aren't covered by that are the focus of a lot of work that we need to do about providing midwife services as well as doulas, and making sure that we're addressing the broad issue of maternal health. It's not been done adequately, even in some of the best hospitals, when we talk about women of color in particular. And so that's why we've got to change the way this system operates. One of the things that we've done is expanded Medicaid to pay for particularly culturally sensitive doulas, culturally sensitive provision of services for women of color. And so there's a lot of work to do. That's why I said that earlier, and I think you heard it consistently. We're not finished. This is an awfully good beginning to something that's important for us to accomplish.
So the governor taking those questions yesterday, but not everybody was on board with this. Republicans overwhelmingly voted against this measure in both the House and the Senate. State Representative C.D. Davidsmeyer talking with Jim Talamonte from the Center Square yesterday, concerned about bad outcomes.
My concern is when you allow others to provide these types of care, do they really have the training if something were to go wrong?
And he also discussed how anytime you put regulations on a company, including insurance companies, costs expected to go up.
Anytime you require insurers to provide an additional service that they're currently not providing, it will cost more money.
So a lot to be said about just the taxpayer costs of certain types of programs like Medicaid, Medicare, but also the consumer cost of these types of policies when people go out to buy health insurance. And one thing to consider too is you see a lot of headlines of Pritzker signs legislation impacting insurance, but it only can impact state regulated insurance, not insurance that's regulated by the federal government. So when Illinois regulates an insurance company, it only impacts a portion of the overall insurance plans that are available to consumers. But for the most part, the taxpayer cost is because of state employee health insurance that is regulated by the state. So there is going to be a taxpayer cost to all of this. Some other taxpayer costs. Yesterday, the governor, he took part in another news conference where he laid out the Medicaid expansion that's happened here. Let me pull this up for you. This is from a news release. And expanded assistance includes support for violence prevention, housing, food, and transitions from incarceration. So this is the Healthcare Transformation 1115 waiver, demonstration waiver that will allow the Illinois Department of Healthcare and Family Services to begin nation-leading work to expand Medicaid coverage. Assistance will soon address root causes of health disparities such as housing and food insecurity and help individuals transform from incarceration. So a little bit more on this from yesterday. You had the Health and Family Services Director, Elizabeth Whitehorn, address some of the things that the Medicaid waiver is going to provide.
The first addresses a specific set of health-related social needs, including housing support for individuals who may be transitioning out of a long-term care facility, out of foster care, or after a period of experiencing homelessness.
So housing now seeming to be part of this this taxpayer subsidized Medicaid program that's going to be funded through your tax dollars and federal tax dollars. So the Medicaid coverage being expanded through a waiver in Illinois, and there's some firsts for the country in this waiver, according to the HFS director.
Next, Illinois is the first state approved to address community violence under an 1115 waiver, allowing for screening and needs assessment, trauma therapy, and other services for Medicaid beneficiaries who have survived violence or are currently experiencing or at risk of experiencing violence. This work will support and complement the state's ongoing initiatives under the Reimagined Public Safety Act and will be coordinated closely with the Office of Firearm Violence Prevention.
So we've already seen the state put out $180+ million for violence intervention and also summer youth programs for jobs. And what this waiver ultimately is going to do is it's going to allow for matching federal tax dollars to come into the state of Illinois for these types of programs, violent assistance and such. But you've also got other things that are being added on to this waiver that Illinois is going to be able to be a first in the nation to provide.
Finally, Illinois is among one of the first cohorts of states to provide reentry services for individuals being released from a carceral setting, including coverage of pre-release services that can begin up to 90 days before release. By moving toward Medicaid coverage of services that have otherwise been provided in siloed state agencies and from different levels of government, we can propel the groundbreaking work of this administration to prevent and end homelessness, to prevent firearm violence, and to better support reentry.
So now it's about implementation and putting those dollars, your tax dollars from the state and federal government to work. This is, obviously Medicaid's a huge program. We're talking billions and billions and billions of dollars, especially when you take into account the state and federal tax dollars. It is Illinois in Focus Daily, keeping you updated on what you need to know to get started here in the land of Lincoln. I'm Greg Bishop. Be sure to like, subscribe, hit that notification bell with America's Talking Network. Get the podcast each and every weekday morning if you can't watch us live here. But also go to thecentersquare.com and subscribe to the daily newsletter so you can stay up to date right here with Illinois in Focus Daily. Have a great day.